Hello and welcome to Live at Kigali. My name is Vidisha and I'm joined here by three great panelists to speak about the One Health agenda in the context of G20 and other multilateral processes. Before I hand over to my panelists to introduce themselves briefly, I just wanted to contextualize the One Health agenda for those of you who may not be familiar with it. It is really a proposal, a joint proposal by the World Health Organization, the Food and Agriculture Organization, the United Nations Environment Programme, and the World Organization for Animals' Health to have a more integrated and collaborative and cohesive approach towards optimizing and balancing the health of humans, the animals, and the environment. So we're very excited about this discussion, and I will hand over to my speakers to briefly introduce themselves. Pablo, I'll start with you.
Thank you very much. My name is Pablo Marco. I am a professor at IE University, and also I have been working for around 15 years in Doctors Without Borders, engaging and collaborating with health ministries in Africa, Latin America, and the Middle East, working on how to improve health outcomes for the population.
Thanks, Pablo. Johnson?
Yeah. My name is Nyarko Boampong, a professor, and I'm the Vice Chancellor of University of Cape Coast in Ghana, and I'm involved in research and also in pharmacy practice.
Thank you.
Thank you. Hello, my name is Sonam Yangchen. I'm a health systems researcher from Bhutan, a small Himalayan country in Southeast Asia. Before that, I worked for Ministry of Health in Bhutan for almost 10 years as a health planner. Then I was with WHO head office for 2 years, and then 2 years with WHO country office in Bhutan, supporting health system strengthening initiatives in the country. Thank you.
Well, welcome all of you, and I'm very excited to just dive into it. Before I go towards particular questions, I really wanted to open it up and ask you all, what does the One Health agenda mean to you specifically? How do you look at the strategies, the principles, and the approach as being relevant to the work that you do in your context? So very brief interventions on that first. Let me start with you, Sonam, this time.
Thank you. For me, One Health refers to the collaboration of multiple disciplines and sectors working locally, nationally, and globally to attain optimal health for people, animal, and the environment. It's not just about people's health, it's a holistic approach. It advocates One Health interventions, advocate for close intersectoral cooperation, which is interdisciplinary expertise and involvement and empowerment, not just engagement of multiple stakeholders, including community engagement. Thank you.
Thank you so much, and also for drawing that difference between, engagement and not just involvement. What about you, Johnson?
Yes. Once she's spoken about the involvement of multiple disciplines, I want to focus on issues involved in One Health. The environment dealing with the atmosphere, where we need to make sure that we do not pollute the environment, make sure that at least the ozone layer is well intact, and then we reduce increasing temperature so as to avoid global warming. In terms of soil, we need to ensure that there are no pollutants in the soil degradation is avoided, and making sure that we use appropriate agricultural practices to provide food and ensure food safety. And also making sure that as humans and plants in the environment, we prevent infections. Infections in the form of viruses and bacteria, and making sure that we prevent antibiotic resistance and using the appropriate methods, and then following the regimens drugs that are prescribed. And in also making sure that we live in harmony with animals, preventing zoonotic diseases, and making sure that we are able to protect the environment. And for the environment to sustain us, we need to protect the biodiversity and also ensure that we conserve the environment to continuously support lives on this earth. So in all, this cannot be done without the involvement of all the stakeholders, working in concert, making sure that we promote health among us. Thank you.
Thank you so much. I think you articulated that perfectly. Pablo, anything to add?
Well, not much more. I will say, in my own perspective, okay, first of all, I really appreciate, okay, this vision, this clear vision that human health need to be understood with a more holistic perspective than before. Okay, and unfortunately, we are learning it the hard way. With first of all with COVID-19, okay, and I will add also with the terrible effects of environmental pollution also in many countries. Okay, so we cannot only look at health from the very traditional perspective, but we need to add, as we say, environment and the livelihood of animals and nature in general. And the second element, I think and I hope that One Health will be an opportunity to tackle some of the historical injustices in terms of how the global north is or is not supporting the global south in dealing with the most important health needs worldwide.
Thank you so much. That's a really critical point, and that's a really nice segue to what I wanted to ask next. Sonam, was specifically from the perspective of LMICs or low and middle income countries, and feel free to give me examples from Bhutan. What do you think? How do you think this can actually be implemented, or what strategies do you think might actually be functional? Because we've often come across these really great concepts that remain at the abstract level, and we're not able to find strategies to actually implement those ideas on the ground level. So I would love to hear your thoughts on that.
Thank you. Firstly, I'll start from what in public health, the principle that preventive measures can be more effective and equitable than relying on treatment or cure. It's well accepted globally by all public health practitioners, implementers, and policymakers. So along this line, to address global health threats, the One Health approach, as mentioned by Pablo, calls for a holistic and systems-based approach that recognizes the interconnection between health, human and animal, plants, and environment. And in terms of implementation from LMICs, particularly in Bhutan, to implement the One Health approach, we do have a national strategic plan, which is aligned with the One Health Joint Action Plan developed by the WHO and UNIP and all these 4 agencies which you mentioned. And the strategic One Health Action Plan, the main desired impact of the action plan, be it at the national level in Bhutan or at the global level, which we are discussing right now, is to have a world better able to prevent, predict, detect, and respond to health threats and improve the health of humans, animal, plants, and environment, while also contributing to the Sustainable Development Goals. And now coming to why it's important for LMICs, how it benefits from the One Health and all. What I feel is, as most of you are aware, the COVID-19 and its profound impact on human health, society, economies around the world has highlighted the interconnectedness and has also revealed vulnerabilities. So what we feel is global health is a shared responsibility, but the brunt of global health threats and all, like it's faced by low middle income countries, including my country, Bhutan, because our health system is not yet developed, not yet strengthened to respond to the shocks in the health system. So that's where the One Health interventions come in, and it does have potential to align the ongoing needs of developing countries, including my countries, with the concerns of broader global health community, providing pragmatic and equitable approach to meeting the global goals of sustainable development and supporting the global health security agenda. And the One Health approach, by implementing One Health approach in developing countries, in terms, it has really benefited. I'm now speaking from the perspective of Bhutan in terms of capacity development, resource sharing, raising awareness and advocacy for One Health principles, then support for One Health funding and investment, as well as facilitating in One Health research and evidence generation. And it has really been successful in linking evidence to integrated action strategies, dismantling disciplinary and professional silos among the animal, human health. We did talk about antibiotic-resistant environment health. So among the different sectors in low middle income countries and economies to protect and promote health. Thank you.
Thank you so much. There were such great points in there, and it really reminds me of that really great quote that says, "There are no single issue struggles because we don't live single issue lives." So we do need that integrated approach. I will come to you, Johnson, for your views, but before that, Pablo, I just building on what Sonam so articulately already captured. What do you think for this approach to be effective? For these principles to be really internalized in multilateral processes, what are the critical elements that we absolutely have to keep in mind so that this very transdisciplinary, multi-sectoral approach can actually be operationalized?
I think that a global treaty like to operationalize One Health should tackle 4 critical issues. Okay? The first one is the cost of drugs and vaccines in low and middle income countries. And let me give you an example. For example, tuberculosis is a disease that still kills more than 1.6 million people every year and affects the lives of hundreds of millions of people. There are great drugs available to deal with it. But for example, one of the most effective drugs, the price for this drug is 16 times higher than the cost of production and distribution. Okay? Why? Because of international intellectual property rights. Okay? International intellectual property rights, including the cost of IP, of intellectual property rights, in the cost of drugs in the developed countries makes a lot of sense, but doing the same with developing countries doesn't make any sense, basically, because it's basically preventing the use of these drugs for hundreds of millions of people. So this is one. Second issue is we need to find a way to tackle the cost of research and development for tropical neglected diseases. Diseases like Chagas, leishmaniasis, trachoma. These names don't say anything for many people in the global north, but they affect the lives of 1.6 billion, with billion people in the world. Okay? So any kind of global agreement should also deal with this big gap. Okay? Third element, in my opinion, is that the global north should also make an effort to transfer to other countries the technology that would reduce the impact of pollution, and specifically air pollution, okay, in developing countries. Okay? And the fourth point, last point, will be also we should find a way also to protect low and middle income countries against the next outbreaks and the next pandemics. Okay? But I will not develop it because I think my esteemed colleague is going to speak about it.
Thank you so much, and also for providing that great segue to the question I was saving for you, Johnson. So, these conversations are great, but the pandemic treaty is currently being negotiated. We all know, based on the COVID-19 experience, that principles of inclusivity, transparency, they really have to be at the heart of any pandemic or health-related treaty to really be effective and work for the not just LMICs, but really the most marginalized people in the world, wherever they might be. We'll see where the pandemic treaty lands, but at the moment, it seems like in several places the language can be diluted. It doesn't necessarily go the way that we want to. So I just want to open up to you to contextualize what's currently happening within this broader framework that we've discussed so far. What are your thoughts?
Yes, I think it goes with responsibilities and then also the benefits. I think every country should also be able to provide the legal frameworks for and then also financing to ensure that whatever the guidelines that are provided by WHO, it can be implemented in the respective countries and ensure that there's equity of resources, making sure that people get access to health facilities, and also making sure that we provide them with the needed services. Okay. Another one is that if we are able to sort of set up coordination centers and also national focal points where there will be communication between WHO and then the national units to provide a specific requirement to make sure that we provide the services that individuals need. We also need to set up sovereign systems to provide data for analyzing and then ensuring that we implement strategic interventions to spread the diseases. And lastly, we need to set up rapid response systems, making sure that we are able to attend to any emergencies that may happen in the course of development.
Thank you so much. And I did not imagine the time will fly so quickly, but it appears that it has. So I suppose I just want to end by saying that as we were talking, it seems like there's a lot to be done. And it has been diagnosed multiple times that different ecosystems, whether that's the people working on climate justice, people working on health, people working on animals' right, these ecosystems and these multi-stakeholder actors must work together, must speak with each other. And it seems like the One Health approach provides a blueprint or at least a starting point for that. I see that we're running out of time, so I'll have to end there, but I do want to just open it up for any final remarks for all three of you. Any of you have any final words?
Just a strong economic case provided by the World Bank for One Health. It says that the cost of prevention is moderate compared to the cost of managing and responding to pandemics. There's a lot of statistics. The World Bank's global estimate of prevention costs, guided by the One Health principle, ranges from 10.3 billion to 11 billion per year compared to cost of managing pandemics, which according to the estimate by the G20 Joint Finance and Health Task Force accounts to 30.1 billion per year. So I would like to say that there's strong economic case for promoting One Health. Thank you.
Great, thank you so much. So we will end there, and thanks for your time.